Fala aí, galerinha, tudo bom com vocês? Bem-vindos ao canal, tá? Daí, deixa eu pensar, vamos fazer o que aqui, ó. Outro um aqui, Surge Squad. Vamos ver o que nós podemos fazer, ó. Eu quero fazer o mais nojento. Desse dedo, vai. Start. Está carregando. Está carregando. Tô pensando aqui agora. Tem que esperar essa porra carregar. Carregou essa porra.
Hello, and welcome to Surgery Squad's virtual ingrown toenail removal. I'm Dr. Jeff, and I'll be guiding you through this procedure today. An ingrown toenail happens when the edge of the toenail grows down and into the flesh of the toe. An ingrown toenail happens when the edge of the toenail grows down and into the flesh of the toe. When this occurs, there is usually a moderate amount of pain, redness, and swelling around the toenail. An ingrown toenail is usually caused when extra pressure is applied to the toe due to shoes that are too tight or too loose.
Mandou isso no dedo. Unha cravada, eu acho.
Foot or toe deformities, injuries, and fungal issues can also be contributing factors. There are some ways to treat an ingrown toenail at home to relieve some of the pain. But remember that you should never attempt to remove an ingrown toenail yourself. If you're a diabetic and have an ingrown toenail, it is recommended that you go to the doctor immediately. Now that you understand the causes of an ingrown toenail, let's put on our gloves and remove one. Our patient is ready, so let's begin by disinfecting the toe. Now, we need to numb the toe with a local anesthetic. We'll have to inject the anesthetic in several locations around the toe.
Aplicar anestesia aqui, aqui e aqui. Que legal.
Great. Now we'll wait a few minutes for the toe to get numb.
5 minutos depois. Caramba.
Now that our patient's toe is numb, place the special tourniquet around the toe. This will help reduce the amount of blood coming from the wound. Once you've done that,
a gente coloca o dedo.
First, carefully slide one blade of the nail anvil under the affected nail. We're going to go down the nail until we feel a little bit of resistance.
Nossa.
Our patient's going to feel some pressure as we cut away the...
Ai.
Great. Take the forceps and carefully remove the ingrown nail.
Ai, meu Deus!
It's getting kind of messy now. Let's clean up that blood.
Eu vou ser um médico, é um psicopata.
See that small bit of pale yellow substance right there? It looks like the patient has a bit of infection in the toe.
Tá, por que negócio branco é esse? Ai! Nossa! Nossa, caralho! Muito nojo, mano. Nojo pra caralho. O cara não vê. Acho que nunca mais vou jantar na vida. Cara, calma aí. O cara usou a tesoura pra cortar o dedo. Passa pomadinha.
Place it against the toe and wrap it in a gauze bandage. Fantastic job. Since there was some obvious infection, our patient will be sent home with a...
Vamos pular logo para conclusão.
You did a great job today.
Eu devo uns remédios, uns antibióticos assim. Deixa eu ver. Ô, gente, a gente pode meio que fazer já mais um. Pra gente completar um pouquinho o vídeo. Pensando aqui em usar a pen... Foi esse aqui, ó. Isso aqui é muito nojento. Vamos fazer isso aqui. Vamos ver isso aqui, galera. As coisas são nojentas, mas tudo bem. Vamos jogar essa coisa. E você é um bom médico.
Welcome to Surgery Squad's virtual laparoscopic appendectomy. I'm Dr. Jeff, and I'll be assisting you with this surgery
Vou
today.
pular a intro porque é uma porcaria.
An appendectomy is needed when there is a blockage between a patient's appendix and intestine. The blockage develops over time and may cause occasional pain. However, left untreated, the patient's appendix could burst, causing severe internal infection and potentially death.
E ó, pessoal, vamos entrar no cu do cara, bem pra dentro assim, um tubo. Aí ele vai cortando os negócios em problema que dá problema no estômago. Depois.
Our patient is a female in her 20s that has been experiencing severe pain in her mid-abdomen, vomiting, and a mild fever. These are all common symptoms of appendicitis. Let's scrub in before this gets any worse. Our patient has already been prepped and is sedated, thanks to our dedicated nursing staff and anesthesiologist. First, we'll insert an endotracheal, or breathing tube, in the patient's mouth and into her throat to help her breathe during the operation.
Nossa, tem que garganta, caralho!
Since I've already taken care of inserting a catheter into her bladder,
acho que é no cu não, acho que tem uma garganta mesmo.
Thanks to the advancements in medical technology, our patient doesn't have to be cut open to have her appendix removed. Instead, we'll strategically place special surgical instruments, called trocars, through small incisions in her abdomen to perform the surgery. We'll begin by making one small incision in her upper abdomen, one in her lower abdomen, and one in her navel, also known as the belly button.
Tá, pô, vou ter que cortar esses dois membros. Esses três buracos.
You handled that like a pro. Now we need to pump carbon dioxide gas into the patient's abdomen to obtain a better look at the surgical area. Next, we need to insert our laparoscopic camera through the umbilical trocar. Images from the camera are projected on our monitor to allow us to inspect our patient's abdomen and confirm that the appendix is infected.
Tá, porra. Tem uma camerazinha.
The inflamed and swollen area you see is the patient's appendix. Our next step is to remove it before it becomes an even greater problem for our patient. The appendicular artery needs to be sealed using a diathermic instrument which uses extreme heat to cauterize the artery. The artery is then divided using scissors. So far, so good. Keep it up. The appendix now needs to be lassoed with a detachable snare. Take the detachable snare and slide it over the appendix all the way to the base. Repeat this step 2 more times, placing 2 more loops above the first.
Ai. Que nojo, mano.
Almost there. Now we need to remove
psicopata.
Use the scissors to snip between the loops.
Deu leg.
Notice that when you snip, a little pus comes out, indicating that the appendix is infected. Don't worry about it though, we'll clean up everything. To remove the appendix from the abdomen, place it into this specimen bag and pull it out with a trocar.
Saquinho dentro.
Now onto the cleanup. We've inserted a device that sprays saline into the abdomen. Move it around so that everything gets sprayed clean. With a flick of a switch, our saline is suctioned back into the same device. Finally, we'll remove the trocars and close the incisions with a few
Nossa, grampeando, porra, mano. Que psicopata.
Excellent work. The length of the inpatient care and the recovery process following an appendectomy usually varies based on the severity of the appendicitis and the person's age. Luckily, our patient is relatively young and healthy, and we caught her condition early. She should be clear to go home within a day if there are no complications. After being released from the hospital, it is recommended that she limit her physical activity to help the tissues heal faster, but she will need to walk short distances several times a day to speed up the recovery process. She should make a full recovery from her appendectomy within 4 to 6 weeks since her appendix did not rupture. Had it ruptured, a full recovery may have taken up to 8 weeks. And that's an appendectomy. You did amazing. Why not try your surgical skills in another surgery here on Surgery Squad?
Ô pessoal, vamos parar o vídeo por aqui porque eu tô precisando, porque eu tô com nojo desses vídeos, mano. Tô com nojo. É só tubinho entrando no cu, entrando no sei lá o que. Quer saber? Vamos parar o vídeo por aqui que no próximo vídeo a gente vai fazer outra coisa que eu não sei o que vai ser. Mas vou pensar alguma coisa, então se inscreva no canal, por favor.